Good day, everyone. I am Pia Marveth P. Moreno, a student nurse from Visayas State University. And in today's video, I will talk about antithrombin III deficiency. So let's get started.
What is antithrombin III? Antithrombin III is an anticoagulant protein which is made by the liver. And antithrombin III deficiency is when a genetic mutation makes antithrombin III either deficient or defective. This causes excessive clot formation, and the clots can get lodged in small vessels that nourish different organs and tissues, causing strokes. Antithrombin helps regulate clot formation, and it also prevents clots from getting so big that small parts of the growing clot break off in the form of emboli. What are the causes of antithrombin deficiencies? Antithrombin deficiencies can be acquired or genetic. Acquired deficiencies are more common and result from impaired production of antithrombin III due to liver disease or protein losses such as nephrotic syndrome or disseminated intravascular coagulation or DIC. With DIC, clots form all over the body from trauma, sepsis, or medications, and this depletes both procoagulant and anticoagulant factors, so severe bleeding ensues. In genetic causes, it occurs via an autosomal dominant inheritance pattern, and they are further divided into type 1 and type 2 disease. With type 1, there is a quantitative defect, so the person doesn't make enough antithrombin III. In type 2 disease, there is a qualitative defect with antithrombin III, so while enough of it is produced, the mutation leads to a structurally abnormal protein that doesn't fold properly and therefore can't do its job right. What are the symptoms of antithrombin III deficiency? So most people with antithrombin III deficiency present with a venous thromboembolism. Most commonly, a clot forms in the deep veins of the leg and then travels to other parts of the body like heart and the brain, causing strokes, or the lungs, causing pulmonary embolism. Clots that form in the arteries are called arterial thromboembolisms, and it can occur as well, but they occur less frequently than venous thromboembolism in patients with antithrombin III deficiency. Heparin insensitivity can be seen with individuals that don't respond to heparin that is given for blood clots. What are the risk factors of antithrombin III deficiency? Antithrombin III deficiency can be suspected based on a family history of deep vein thrombosis or DVT and based on lab values, especially the partial thromboplastin time or PTT before and after heparin administration. So with antithrombin III deficiency, the PTT doesn't change or it doesn't prolong as much as it should after heparin administration. How is antithrombin III deficiency diagnosed? Diagnosis can be confirmed with a functional assay for plasma antithrombin activity called the antithrombin heparin cofactor assay or AT-heparin cofactor assay. During this test, the ability of heparin to inhibit thrombin or factor 10A gets measured. Antithrombin III deficiency is diagnosed when an antithrombin activity is less than 80% of the normal range in AT-heparin cofactor assay. What are the possible complications of antithrombin III deficiency? So blood clots can cause death, and blood clots in the lungs are very dangerous. What medication is needed to treat antithrombin III deficiency? A blood clot is treated with blood thinning medicines, also called anticoagulants. What are the treatment modalities used for patients with antithrombin III deficiency? So treatment is necessary when individuals develop a clot, and anticoagulant therapy can be done with a direct thrombin inhibitor like argatroban. Additionally, prophylactic anticoagulation with warfarin or the above medication can be used in high-risk settings such as during surgery. For secondary prophylaxis, meaning preventing the recurrence of deep vein thrombosis, warfarin or low molecular weight heparin can be used, and the latter is preferred during pregnancy. And even though heparin or its low molecular weight counterpart is not as effective as other anticoagulant drugs used with antithrombin III deficiency, it's the only one that doesn't cross the placenta, so it doesn't have any negative effects on the fetus. So it is given in the hope that it can prolong the PTT just enough to have an anticoagulant effect. In addition, many of these people benefit from replacement antithrombin III either via recombinant antithrombin III or plasma transfusions, and is indicated for patients with antithrombin III deficiency who are not controlled with oral anticoagulants. So what is the prognosis or the outlook of patients with antithrombin III deficiency? Patients with antithrombin III deficiency have a good outcome if they stay on anticoagulant medicines.
Thank you guys for watching, and I hope you've learned something about antithrombin III deficiency. God bless everyone!